Hi, Terry. Hi, Dr. Jordan. My name is Rida Nasir, and this is my colleague, David Morado. We are with account executives. We're account executives for Johnson & Johnson under Ethicon for about 2 years now. Thank you again for meeting up with us. We appreciate it. A little bit about Johnson & Johnson. We are a medical company that provides medical technologies for many diseases. We help cure any medical mysteries, and we've been in this industry for about from 1886. So we have a lot of experience and a lot of knowledge in medicine.
Again, thank you guys for Terry and Dr. Jordan for meeting with us today. 10 minutes is a big ask for a well-renowned surgeon, so we appreciate you taking the time out. And as I'm sure you guys have had surgeries today, as a matter of fact, and maybe you in between surgeries. So again, thank you very much for meeting with us.
Yeah, we did have a surgery just this morning, but everything went great. And we're glad to be here and spend these 10 minutes with you. Happy to hear what you have to say.
Thank you. Thank you. We look forward to it. So as Britta mentioned, Johnson & Johnson has been in the space, the medical technology space since 1886, but I would like to say that every practice is a little bit different. So just to better understand the needs of the Johnson & Johnson orthopedic group, the Jordan orthopedic group, would you guys mind telling me what you guys specialize in and give me some background? That way we could better assist in assisting your patients in the practice.
Yes, we are a well-known practice that specializes in knee and hip surgery and replacement. Dr. Jordan and I have been working in this industry about 10 years, and currently we are using suture and staple as part of our wound closure method. It was good until we saw an unfortunate spike in infection. It has been tough to find a product that delivers effective wound closure at a fairly good price.
Okay, and Dr. Jordan, if you mind expanding, is that what the practice is focused on? Is it only wound closures, or is there any kind of other elements that the practice is looking to improve?
Yeah, so like Terry said, we have been focused on stopping reinfection rates, because a lot of patients have been complaining that the staples and the sutures get infected when they go about their daily lives, because a lot of people don't take adequate preparation to make sure that these products don't get infected. Because it's quite easy to make a mistake with staples or sutures. And these difficulties have been causing us trouble not only with multiple readmissions, wasting the time of our doctors, but also damaging the reputation of our company, because customers are leaving scathing reviews on our practice because they're so dissatisfied with these results, the reinfections that happen.
Okay, and correct me if I'm wrong, but the things that I heard currently was that you guys want to improve surgical site infections, you want to increase patient satisfaction, and you want a product that really is easy to manage for the patients. Is that correct in saying?
Yes,
yeah, that sounds right.
Okay, I think Johnson & Johnson definitely has some applicable solutions that will better help your practice. And for that, I'll turn it over to Rita to explain some of the features and benefits, as long as the contract proposals, if you guys don't mind.
Of course, we don't mind. Go right ahead.
Okay, before we begin, I just want to confirm that Terry, you're the one who manages the buying process, correct?
Yes, I am.
Okay, perfect. So can I share my screen with you? I will be talking a little bit about Dermabond Prenio and our business proposal.
Okay. Of course, go right ahead.
Perfect. Okay, so can y'all see my screen?
Yes, I can see your screen.
Yes.
So this is our Dermabond Prenio. As you can see, that the white strip is our mesh. It is trimmable, and you apply it on the wound, and then right after you apply it on the wound, you use the pen-like applicator, which has the glue in it that does most of the work. So it will keep the mesh in place. and it will benefit you because it doesn't take too long to dry. It takes about an hour. Once it dries, the patient is free to go home and take a shower or do anything that they like. It doesn't require too much of a wait time. So once it dries, they can just leave, and you can get to your next patient. One of the things is that it is pain-free, so it doesn't require any pain, and it doesn't have any pain that comes with it. And it's David, would you like to add on to it a little bit?
Yeah, I mean, for sure, it definitely helps the patient as far as wound care. It doesn't require the product itself. It peels off after I want to say a week. If you could correct me if I'm wrong, Rita.
1 to 2 weeks.
1 to 2 weeks, and the patient doesn't have to do anything else except for let it peel, and doesn't have to come back to the office to do any type of removal of staples or sutures or anything like that, because it doesn't have any, and you just let it peel off and re-examine the wound at the post-op.
So we have created 3 proposals for you. The products include Dermabond Prineo with 3 different sizes, Dermabond with 2 different sizes, as well as Dermabond Advanced and Dermabond Mini with just 1 size, which is 22 centimeters. So our first year contract, you will be paying a total of $37,500. You will be the first to receive any promotional deals. For our second proposal is a 5-year contract where you pay a total of $33,750, again, for all of the products. You save 10%, and that roughly around $3,750. Again, the first to receive any promotional deals. For our last contract, it's a 10-year contract, same amount of products. Your total price would be $28,125, and you're going to be saving around 25% off, which is roughly $9,375. And your benefits is that you're going to be the first to receive any promotional benefits. So looking at our product, how it works, and looking at the deals that we're offering, do you have any questions? Would you like to learn a little bit more about our product?
Yeah, so from what I've seen, your product looks pretty solid, good overall. But one thing I'm a little bit concerned about is that we have a lot of staff here at Jordan Orthopedic Group, and I was just wondering how are our staff going to be able to adapt and switch over to using this new product, because staples and sutures have been a long time staple in our practice. So I would just like to know how we're going to switch over.
Yeah, so like I said earlier, it's really easy for our patients to use. So it's even more easier to apply for the medical staff to apply it. Of course, we will be there to help you out and guide you on how to put it on and how to use it. And you will receive feedback from your patients, so you'll also know how to do that. We will teach your medical staff. It doesn't take too long. It's just a two-step process, applying the mesh and the gel. So it shouldn't take too long. Of course, you can always hand it over to your assistants, and they can, right after you're done with your surgery, you can just go and they can apply it for you. And it doesn't take too long. It should take them like a couple surgeries and they'll be good to go.
All right, sounds good.
I see your benefit, but my concern is their flies.
Absolutely. Since you guys have been in the practice for 10 years, I'm sure you guys know staples and sutures, I mean, it doesn't get any cheaper than that. So direct pound for pound costs, yes, Dermabond Prineo is a more expensive product. However, if you take into account for your surgical site reduction in surgical site infections and the increase in patient satisfaction and the goals that the practice has for the future, it definitely, I feel it absolutely outweighs the cost to use this product over staples and sutures, especially with patient care being so important to you guys. I think it's well worth the price.
Yeah.
Thank you so much.
One thing we would like to mention is that it doesn't leave any train track marks on to the patient's skin. So you have the benefit of, the patients are completely satisfied with not only the customer service, but also the fact that their wound closure is very clean and
Minimal scarring for sure.
Exactly.
Mm. Okay, thank you
Okay.
so much for the information. I'm really interested in the product, and I believe 10-year contract is the best for us since it has a lot to offer and we'll get discounts.
Perfect. So just to make sure, you would like to go with the 10-year contract.
Yes.
Okay, perfect. So we will offer a trial for you. It's going to be a 1 month long trial, 30 days.
Mhm.
You can try out the product. You can see if you like it. You can test it out, see if you're getting good reviews on it. And once you feel like you are comfortable with the product, then we will definitely send you paperwork on your way.
Okay, that sounds good. Thank you.
Okay.
Thank you guys. Thank you for meeting with us, and it's been a real pleasure.
All right. Thank you.
Thank
Have a nice
you.
day.
You too. Bye-bye.
Bye.